Hello everyone. So today I wanted to talk about one very specific exercise, the glute bridge. And I wanted to talk about this in relation to pain in the lower back. I will say this will also apply to if you have pain through the hips, the glute, especially the piriformis, which is on the outside of the glute, or if you are a newer mother, so have recently had a child, I would say within the last year to 2 years, and either haven't done a lot of exercise, haven't seen a pelvic floor physical therapist, or just haven't done a lot of very specific movement for a lot of your core, abdomen, and pelvic floor. So with this, the glute bridge is such a common exercise for lower back pain and some of these other issues, but I often see people don't do them right or aren't really coached through them in a way that is going to provide the most benefit. So that's what I wanted to do today. I just wanted to walk you through how to get the most out of this exercise and do it in a way where you're actually going to see results and we're going to see changes in the body. So you do not have to do this exercise with a band, but I do prefer to do it when we're talking about lower back pain and pelvic floor, glute pain. To do this with a mini loop band, you can get these on Amazon. There's a 5-pack that's $9.95 or $9.97, less than $10. That is just, it's so worth it because these bands can be used for so many things. So we're going to start with this band. If you have the band, once again, you don't have to have it. You're going to put it around your legs and put it just above your knees. So you don't want it touching your knees, you want it kind of just above your knees. So we're going to start this on the ground. So you're going to lay on your back here and your head's going to be flat. The first thing you want to do is bring your heels in and your feet in close to your glutes. So pretty much as far as you can bring your heels into your glute, that's how far I want you to come in. And start with your feet about hip width apart. You should have a little bit of tension through the band. So your knees should want to come together and you're just very, very gently pressing out against here. So the next thing I want you to do, you can just kind of relax your hands down on the floor and I want you to try and relax your upper body. Now we're going to press through the heels and I want you to press kind of your low and mid back into the ground. Now, the next part here is the part that's often missed. So now our lower back and mid back is pressed firmly into the ground. But now what I want you to do, I almost want you to think about lifting your tailbone a little bit off the ground and pressing that low back even more into the ground. Now to do this, you should have to squeeze your glutes just a little bit. And now I want you to accentuate that glute squeeze and really try and squeeze the glutes even in this bottom position. So we haven't started moving yet. We're just thinking about our low to mid back is on the ground. Then we lift up that tailbone just a little bit. And now we're squeezing the glutes a little bit. Now I want you to pull your belly button in towards your spine. And I want you to squeeze your belly like someone's going to come tickle you. You know, if someone's going to come tickle you, kind of brace in your belly a little bit. So this is our starting position. So in this position, we want to hold all of these things. So we're squeezing the glute, that tailbone is kind of tucked up, our belly button's pulled in towards our spine, and we're squeezing like someone's going to come tickle us. This should be squeezed the whole time as we come up and as we come down. Now this is a lot if you've never done an exercise like this. So what we're going to do, so we're squeezing everything. We're going to press up through the heels, but you are gripping the ground with your toes. So we're going to press up, keeping that tailbone tucked under, big squeeze through the belly, and you're going to lift up, really big squeeze of the glutes. This can be a really small lift. It is as high, you should come no higher than being able to stay tucked. So if your tucked position is here and you are barely off the ground, this is your end position, and you should be able to slowly work your way up into being tucked at a higher position. I want you to hold at the top for about 3 to 5 seconds, focusing on really squeezing those glutes. Once again, we're still staying tucked and then coming down nice and slow. And when you come down, what should happen is your mid back down to your glute should all come down at the exact same time. It should not be a domino effect where you kind of like let your butt come down and then your back comes down, or your back comes down and then your butt comes down. Everything comes down together at one time. Now at the bottom, what I want you to do is I want you to reset. So we're taking a second at the bottom, thinking about lifting that tailbone up a little bit. You're pulling the belly button in, squeezing the belly like someone's gonna come tickle you. We're squeezing the glutes, a little bit of tension through the band. We're squeezing everything, we're breathing, we're relaxing our upper body, and then we're pressing up again. We're holding at the top for about 3 to 5 seconds, holding that nice tucked position, and then we come down nice and slow, and there you go. So you can kind of vary how many you do. I'd start with about 5 or 6, work your way up to about 12 to 15. Then I would recommend progressing once you can get to 12 to 15, just like that, then progressing on to a different variation of a glute bridge. You can do this once a day, you can do it twice a day, and you can do this every single day.